Would you consider dating someone with a mental illness?
You mad? No? No. No. No.
May I ask why?
No, just no.
No reason why.
Why would I want a mad girl, Davia? Tell me. Like, no.
Do you know that things like depression, anxiety, eating disorders are mental disorders?
She keep them to herself.
So if you meet a person and you don't know that they have a mental illness, you'll be fine.
Yeah, pretty much.
Hi, I'm Davia Hines.
And I'm Jodi-Marie Hastings.
And today, we're going to be going around the University of the West Indies, Mona, Western Jamaica Campus to get students' views on mental illnesses.
We're going to be asking them some questions to find out how much they know and how they feel about this topic.
Let's get started.
Would you date someone with a mental illness?
That question is funny. Any response is appropriate? Hell no.
Why not?
I don't want to wake up in blood one day, or wake up and my entire family is killed, or wake up and something went wrong. Yeah, it's very awkward and weird to deal with. No, they gotta fix that.
You know, that's a bit of a stereotype, right? Did you know that like insomnia is a mental disorder?
Well, to me, not really, because I don't really sleep either.
Would you date someone with a mental illness?
Well, not like if I knew that they had a mental illness from the get-go, I don't think so, no.
Why not?
Well, mental illness usually associates with chronic disease, so in a long-term relationship, I think it can act up.
I really don't think so. It's hard to interact with other people and deal with their problems, and that's just another echelon. It's way more difficult, and you have to be a really selfless person to deal with that.
No.
Would you like to elaborate on that, sir?
I wouldn't do that because basically being around them, everything would be unexpected and random, so anything could happen. Like she could just lose it one day and like flip and like you can think about what she do, right?
No.
Could you elaborate on that?
No, because like you never know what they're thinking, you never know how they're going to react to certain things, so I really couldn't deal with that.
Okay.
Seeing that there are different severities, it depends, because you have mental disorders like from early childhood where you might have reading problems with mathematics. So if it's something as simple as that where they just need additional attention and it's not something debilitating or it's can affect your overall functioning, I don't see a problem with it.
I don't think so.
Why? Why not?
It might be hard for me to relate to them. I'm not sure how we will converse. Yeah.
No, I would not.
Why not?
Because I don't think I'll be able to communicate with the person.
In what way? What exactly would stop you from communicating with this person?
And it all depends on what the person's mental illness is, because I just think it would be difficult for me to kind of understand the person. Whether, I don't know, just difficult. I wouldn't.
Well, based on what you're saying, it sounds to me that you're thinking about the more extreme mental disorders. Did you know that there are less severe ones, such as insomnia, which is actually a mental disorder? Did you know that depression is a mental disorder, eating disorders, mood disorders, all those are... Did you know?
I knew, but I wasn't thinking along that line.
Do you think that people with mental illnesses should be allowed to go to school?
Well, yeah, they're normal people just the same. But I think that, they should have like certain regulations and things in place for those type of people.
Do you think that people with mental illnesses should go to normal schools?
I think it depends on the severity of the mental illness that they have, because you have some people who are criminally insane. If it's that serious, hold your side. But otherwise, they're just sick. Do I have to go to a different school because I have a cold?
No, I don't think so. Because when you talk about mental illness, it's like a sickness of the mind. So I don't think they'll be functioning normal like normal children. They shouldn't go to normal schools. They should have a program for them
especially?
Well, no, that wouldn't make any sense. It'd be best to have like different institutions that can focus more on persons with mental illnesses. For instance, because persons with mental illnesses are normally like slower than you and I. So a different institution would be best. They could get the necessary attention that they need.
It depends on the type of disorder that the person has, because as you know that some disorders you are still functional in society. So I would say it depends on what disorder that individual has.
If you bear in mind the culture of Jamaica as it relates to mental illnesses, in that Jamaicans just see everybody who is not within the cultural norm or normalcy to be mad people or people with mental illnesses. So in that sense, it's not about segregation or pulling them and pushing them, but it's about if it is that they've had evaluation and is deemed something that needs attention, special attention, then under that grounds, yeah.
Okay, so if they don't need special attention, regular school is fine.
Yeah, because when you're having a mood disorder, they have different levels, there are different scales to it. So at the end of the day, it's all about how severe is it? Can they function in a regular setting, or is it that they're gonna have whatever?
No. Reason being because they'll be very disruptive and they would not be able to socialize or interact with regular peers.
Honestly, I really don't feel that people with mental illnesses should have children, because they're not, like, they can't take care of themselves that well without the medication, because when you're mentally ill, you have to take medications to have your mind and keep your sanity, and I really don't think you can take care of a child being mentally ill. So that's my opinion. Kudos to them, but I don't think so.
All right, so that was a little different than what I expected.
Yeah, it really was.
So I guess now it's our turn. Jodi, would you date someone with a mental illness?
I think personally, it all depends on the type of mental illness. For example, I don't think I would put myself in a situation where I would date someone with, say, schizophrenia, because, as an example, that seems to be what most people know about. Because for me, I think it would be a bit hard for me personally. But if it's one of the milder forms of mental illnesses, for want of a better word, I think I would be more open to an experience like that, such as insomnia, anxiety disorders, learning disorders. I think I would be more open to those types. What do you think? Would you date someone with a mental illness?
That's a hard question. Maybe. I guess it depends on the person, because I'm sure there's other aspects of the person other than their illness, so have to know the person. Yeah. All right. So that's pretty much it. I don't know what to say.